Hi, my name is Alan, and I've received a requisition to place a Miss Katie on a 35% simple mask. And the first thing I'm going to do is gather my equipment here in the respiratory care department. I'm going to grab a simple mask, O2 pulse oximeter. I'm going to have my stethoscope. And at this point, I will take my requisition and I will proceed to the patient's floor, and I would check the patient's chart, make sure that I have a valid order for the oxygen therapy, and I would also check and make sure if I have appropriate indications for why I'm placing Miss Katie on the oxygen mask at 35%. I would also, while looking at the chart, I would look and make sure or check for any kind of arterial blood gases. I'd make sure I looked at her identification, such as her name, date of birth, medical record number, and her patient identification number. I would look at my order. I would verify that order was correct for this patient, and at this point I would proceed to the patient's room. I would knock on the door. Hi, Miss Katie.
Hello.
Hi, my name's Alan. I'm from Respiratory Care. I'm here to put some oxygen on you. Your physician felt it might help you feel less short of breath. How are you feeling right now? Not good? Okay. Let me just go ahead. I'm going to wash my hands very quickly. And I would wash my hands. And then I would proceed to the patient's bedside. The first thing that I would do is I would check the patient's ID. And it says, Miss Katie, what is your date of birth?
8/15/92.
Okay, good. That matches my requisition and her patient ID. Our medical record number, the patient identification number match, so that is appropriate. Miss Katie, doctor's ordered you to be placed on some oxygen. I have to make sure that you're aware of a few things. Whenever you're wearing oxygen, you cannot smoke, you cannot use electronic devices, and if you're going to use any kind of hand creams or lotions, make sure you check with nursing first. There's nobody else in the room right now, but if any family members come in the room, make sure you remind them of that also. Okay. Also, while you're wearing oxygen, if for some reason you start feeling lightheaded, dizzy, or nauseous, I need you to make sure you tell the nurse so that they can let me know so I can come and reassess you. Okay? So again, no smoking, limit the use of electronic devices. You're going to use lotions, make sure you check with the nursing first. And if you for some reason start feeling lightheaded, dizzy, or nauseous, feeling tremors, shaky, you're going to let the nurse know, and then they're going to let me know. Okay, good. At this point, I would check her heart rate, respiratory rate, sat, color, level of dyspnea. I check her heart rate. I check her pulse. I check her respirations. I then would take my pulse oximeter, which measures the oxygen saturation in her arterial blood. It's actually the saturation of her hemoglobin. And if she hasn't had exposure to carbon monoxide, it should be a pretty good indication if she has good perfusion as to what her O2 saturation is, how saturated her hemoglobin is. And right now her saturation says that she has a sat of 90%, which is not adequate for somebody her age. At this point, I've already said I've checked her heart rate, respiratory rate, sat, color, level of dyspnea, and I'm going to set up my oxygen device. It is a simple mask. It's one of the first of the reservoir masks. And the simple mask will give an FiO2 range between 35 to 50%, and the flow range has to be between 5 to 10 liters per minute. I would let the patient feel what the oxygen mask is going to feel like and feel what the flow is. So a minimum of 5 liters is going to give me about 35%. And 10 liters, the high range is 50%. And the doctor's ordered a 35% simple mask. So now I'm going to set this at 5 liters per minute. And the reason it's at 5 liters per minute is that it has to have a minimum amount of flow because we want to make sure that when she exhales, that the CO2 that she's exhaling will escape through these holes on both sides. So this is a 35% simple mask. And now I would ask Ms. Katie, how do you feel? Okay, feeling pretty good. At this point, I reassess my patient. I check her heart rate, respiratory rate, sat color, level of dyspnea. I take the pulse oximeter and I would check her saturation again. And now her saturation is 95%, which is good. At this point, I would tell Ms. Katie, after we reiterate, remind you again, no smoking, no electronic devices, and any kind of hand lotions or gels that you're going to use for your hands or your face, check with nursing first. Okay, if you start feeling lightheaded, dizzy, or nauseous, let the nurse know, and I'll come back and check on you. Do you have any questions for me? No? Okay. Done my reassessment. At this point, I would go to the patient, to the sink, I'd wash my hands, and then I'd go to the chart, and I would chart my results of what I've done, and I would make sure that on the door there was a no smoking and oxygen use sign posted.